Another piece of the care of a CLL patient is that many people come into clinic hearing that they have a new cancer, and then we say, okay, for now we're going to watch you. And that is an incredibly challenging thing for many patients. That's an adjustment in how they see themselves and their health status, and that requires a period of adjustment. So through that phase, I also make sure that our team is available to support people. That can include involving social work or involving psychiatry, because often these patients are adjusting to a new phase of their life, and being there to support that is important. The other thing I talk to patients about is, where are the reputable sources? Because finding resources that are honest and realistic are important. And, as we all know, patients can get online and find some very misdirected or misguided information. So I refer patients to some of the professional societies that have great resources for patients with CLL. And specifically, I think about LLS, LRF, there's a CLL society. These are some really great resources available who have online presences as well as written information that can be very helpful for our patients.
I agree. I also have used those resources, and I have the same thing in my clinic. A lot of times patients even find patient support groups helpful. I think it is a situation that you already highlighted, where it is a disease that's very different for different individuals, which can make finding this information, I think, all the more important. Approximately a third of patients with CLL might never need therapy and are on a program of active observation and these supportive care measures that we've highlighted. Another third of patients might need treatment right away at the time of diagnosis, and approximately another third of patients don't need treatment right away, but will need treatment at some point during their disease course. And so finding where they fit in that information and having the care team kind of guide patients to the appropriate resources, I think is really, really important. Mm-hmm. So I think one of the things that I commonly encounter in the clinic with a chronic disease, especially one that we might not need treatment right away, is who is the patient support system. I think the medical team is a vital part of that support system, but I found that patients really benefit from identifying other sources too. So one of the things that I found that many of my patients really have found useful is, educating themselves, both through the visits we have together with the patient, but other resources, educational resources. There's patient support groups out there through national societies or even local groups that patients find important. And then a lot of my patients find it really helpful to have a caregiver, another person, as another set of ears during the visit, and really partnering with them, at home, outside of clinic visits, living alongside the disease in everyday life. I think, that looks differently for every patient, and bringing in kind of expertise. If a patient can't identify that social support on their own, a social worker is really important to really make sure that they're, maximizing their healthcare and really understanding the information and coping with the diagnosis.